Okay, folks, let me just. Okay, folks, let me repeat, we are live behind the scenes for our YouTube folks, and we're just about to go live. Okay. All right. Sherry, keep an eye if David comes in on mute and doesn't realize it to unmute him for us. And
okay, I got that.
I'm going to stall for maybe 30 more seconds, and then I think we have to go. Oh, we're already 2 minutes. I got to go. There we go. Greetings, everyone. Welcome. This is Eric Glazer, and welcome to our live recording of Bright Spots in Healthcare, produced by Shared Purpose Connect. Each episode, we bring leaders together to not only inform our audience, but to also unearth bright spots, success stories at health plans, hospitals, and other healthcare organizations around the country. Our goal is to identify as many of these bright spots as possible so that you, the listener, can determine if these ideas shared on this episode are applicable at your organization. We believe this strategy of finding a bright spot and cloning it is the most effective way to enhancing healthcare in our lifetime. I encourage you all, if you have yet to subscribe to the Bright Spots in Healthcare podcasts, to please do so. You could listen to an incredible library of episodes with terrific leaders throughout the industry. Some of the recent episodes we've had the privilege of producing for you: How to Reduce Health Inequities. It featured BlueCross BlueShield of Kansas City, affectionately known as Blue KC, Genesee Health Plan and Community Care Cooperative, and My Sidewalk, a terrific show. We also had the president of Aetna's behavioral health business, Cara McNulty, on with Sarah Ratner at Revel Health, talking about silent sufferers and how to identify those individuals and engage them in the appropriate care. Really interesting topic and an important one, of course, putting into light today's climate that we're all in. We had the future of primary care this summer. It was one of our most listened to and watched episodes. It featured Mass General Hospital, Blue Cross Blue Shield, the Michigan Tufts Medical Center, and ChenMed. And most recently, we covered the super determinant of health, the digital divide, which featured Brigham and Women's Hospital, the Medical University of South Carolina, and others on the panel. So I could go on and on. It's been such a privilege to be able to work with all these incredible folks in our industry, truly an honor. And I welcome you to subscribe to the show. Bright Spots in Healthcare is available anywhere you consume podcasts, and there's all that information at your fingertips. So please enjoy. This episode is brought to you by my friends at the Center to Advance Consumer Partnership. We're able to provide you programming on a regular basis throughout the year because some of these very special and innovative organizations that both support our episodes, but also add to the robustness of our discussion. So a big thank you to the Center to Advance Consumer Partnership for helping make this episode available to all of you. You could check them out at www.consumerpartnership.org, and I am for sure will tell you more about them later on in the episode. Today we have an incredible roundtable of experts prepared for you. And as such, we figured for the first time ever, we're going to expand this to 90 minutes. If you are listening by way of the Bright Spots in Healthcare podcast feed, this is part one of a special 2-episode series entitled The Consumer Voice, the Heart of Your Healthcare Strategy. This is an incredibly important topic and will become more and more at the forefront of our discussions, especially as we transition into 2021. So I'm going to introduce you to our rock star panel of experts. The one that's missing just called me. So as soon as I introduce you guys and get this conversation going, I will call him back and figure out what the login issue is. first and foremost, I want to introduce you to Melinda Karp. She's the executive director of the Center to Advance Consumer Partnerships and also the senior vice president of consumer partnership at Commonwealth Care Alliance. We also have Tom Meier, representing one of our two health plan experts. He is the Vice President of Product Development, Innovation, and Member Experience at BlueCross BlueShield of South Carolina, one of my favorite blues, by the way. He also has, previous to South Carolina, a mere 22 years at the BlueCross BlueShield Association and HCSC. And last and certainly not least, we're really not last at all because I'm going to introduce our fifth person who's not even here, but our fourth panelist, Dr. David Webster. He's the Vice President and Executive Medical Director of Clinical Services at one of the most progressive blues in the country, Highmark. Prior to Highmark, he spent almost 5 years at Humana as their senior medical lead for the Texas and Louisiana commercial markets. Our fifth panelist, who I'm probably going to be helping log in, is Dr. David Langer. He is the chairman of the Department of Neurosurgery at Lenox Hospital. He's also the vice president of neurosurgery for Northwell Health. He is the star of the Netflix docuseries entitled Lenox Hill that hit your Netflix app this summer. It was a terrific show, and if you want to get to meet David asynchronously, a little bit better. He was on our show in August on an episode entitled How One Netflix Star is Changing the Patient Experience. Really great hour. It was probably our most listened to episode to date. So great panel. Really excited to have you all. If you want to read their full and impressive bios, Sherry, our producer, has posted that into your chat window. You could check out their full bios and get a sense of all the insights and experience you're about to gain from. Incidentally, we'll be using that chat window for those watching and listening live throughout the show. But if you have questions, and we will have time for questions because this is a 90-minute episode, I will take those questions and integrate them into the conversation as appropriate if you submit them through your Q&A module. The Q&A module is at the bottom of your Zoom interface, and that's definitely the best way of getting your questions heard, as it allows Sherry and I to manage the show a lot more easier. So don't use the chat for your questions is basically what I am trying to say. All right, let's get things started with an icebreaker. And Tom, I'm going to start with you. I want to give the audience some insight into what the methodology or thought process is to applying the voice of the consumer as part of your overall strategy. And then David, I'm going to cue you up second, and I'm going to try to multitask here and try to get Dr. Langer on the show.
Okay. Well, thanks, Eric. Thanks for having me. BlueCross BlueShield of South Carolina is proud to be a part of this. I appreciate the kind words about us being one of your favorite blues. I'll bet you say that to all the blues. But to answer your question around your voice of the consumer and how it bakes into the overall strategy, and the answer is it's a critical component. When we think about what the role of the health plan ultimately is, it is to provide access to care to as many folks as possible. To try to make that population as healthy as possible, and to try to control the spend of healthcare as much as possible, right? And the voice of the consumer is critical, because if you aren't taking into account that consumer's needs, their wants, then how in the world will you ever get them to engage and be an active part of the solution? And that is ultimately what we need. We need our members to become active consumers of care. So when you think about our overall strategy and how it factors in, part of it is listening to the consumer, and also part of it is listening to the purchaser. And the purchaser may be the consumer, or it may be an employer group. Much of healthcare in the U.S. on the private side is purchased by employers, and they have specific needs. And what they're asking health plans ultimately to solve as well. And so it's really trying to find ways strategically to marry those two needs and voices up. And when you can find that overlap, you can have a huge strategic success and a win-win. An example, there has been a huge movement in the industry over the last 5 years, especially around concierge servicing. Health plans historically had very low marks when it came to customer service. Everything was very transactional. And I think the health plans and disruptors in the healthcare industry realized there was an opportunity to do better. And what happens when you can really understand that consumer, when you listen to their needs, and you can insert yourself into their journey and really not only answer their questions, but add significantly more value than they ever realized was possible. That becomes very powerful. Powerful not only to that consumer, but then powerful to the purchaser as well. Because when that consumer now is engaged, they want to keep coming back. You likely have earned their trust, and they're going to be willing to be educated. They're willing to know how can they get the most value they can out of this complicated healthcare system. When you do that, all of those strategic goals around population health improvement and removing waste from the healthcare system really can come to bear. And so that is, I guess, an icebreaker of how we really truly value the voice of the consumer and how we find it as a critical component to our overall strategy.
Awesome. By the way, I promise you South Carolina is one of my most favorite. I won't say that to everyone. All right. So speaking of favorites in the blues world, why don't we bring in Dr. David Webster at Highmark? Give us your high level on the methodology behind the voice of the consumer.
Sure, Eric. Good afternoon, Eric. Good afternoon, everyone. Thank you for inviting me. I'm very excited to be here this afternoon. First, a note about Highmark. Highmark is a blended health system. So we are a blues of with a footprint in multiple states. We cover over 5 million members nationally, and in addition, we have 13 hospitals, 2,500 employed or affiliated physicians. So we an integrated delivery and financing system, or said another way, we are a blended health system. So thank you for your kind words about us being progressive. As one of the largest integrated delivery and financing systems in the nation, it is imperative that we engage our consumers, since we are able to provide that whole continuum of care from both on the payer side and the care delivery side. And that very important voice of the consumer information we collect at the channel level and use that routinely to look at improvements by channel. We are in the process of implementing a voice of consumer aggregation software called Clarabridge, which is a best-in-class solution to pull channel-specific voice of consumer data together. So for example, Nexidia call center data, social media comments, Google reviews, website surveys, our net promoter score, member satisfaction studies, press Ganey reviews, to name a few, bringing that all together so that we can map feedback to the customer journey, because again, we are a integrated delivery and financing system. And in addition, we can identify pain points where efforts to improve those pain points, remove those pain points, and provide the best outcomes. We're implementing this software and this type of solution because prior to this, we weren't able to connect all these opportunities across all of these very different channels. This data visualization provides us a tool to quickly point out areas of removing pain points, but also providing great positive impact for our members, our customers.
Thank you for that. So let me just, so it's Clara, just for the people who are listening and taking notes, Clarabridge, CLARABRDGE, right?
Almost, BRIDGE. So Clarabridge, and it's one word.
Gotcha.
Yes.
And Tom, I just want to summarize your answer too for the group. You talked about the key things is sort of combining and converging the need of the purchaser and the end user. And you mentioned a little bit about how it's important around training and getting folks sort of in the door thinking about the voice of the consumer. Correct, Tom?
Yeah, it's a good point, Eric, and one I didn't hit on too much, but when you are thinking about these concierge types customer service models, you have to think differently. As I mentioned, we've really evolved from transactional customer service model. The old model used to be member calls in, get them what they need as quickly as you can, and then get on to the next member. Right. And so metrics would reflect that. And there's really been a pivot with these concierge models of how do I think differently? How do I know the customer far more than I used to know them? How do I know what benefits they have? What's important to them? And as a result, people are trained differently. You're hiring different. And the metrics are different. Right. So these calls go on far longer than they used to. And we view that as a good thing.
That's great. I'm going to bring in Dr. David Langer, who, being a former guest on the show, was challenging my multitasking skills as a moderator to onboard him while managing the conversation. Hopefully I passed. Not great. David, welcome. We were talking a bit about the methodology, the thought process of applying the voice of the consumer. So can you talk a little bit about your thought process to applying the voice of the consumer as part of your organization's overall strategy?
Well, I'm a physician primarily, and I approach this from a need of my own for the way I treat my patients, which unfortunately isn't always the shiny object that the large health systems pursue. I think there's an aspirational aspect to this of what, number one, what health systems would like to be able to do versus what they can do, and lastly, what they can afford to do. My focus has been primarily on developing a strategy for better communication using mobile for the last 13 years. When I first developed the idea...
Hey David, we're getting a lot of background noise, so it's hard to hear you. Yeah.
When I first developed the idea, I think that there was a lack of understanding of the need for it by the sort of bureaucracy of the health system that I was in, primarily because people want to know how you're going to make money off of it. And without a way to make money, without at least to break even, I think that healthcare systems suffer because we're all in a cash bind, most of us. If you're talking about a small practice or a small, for-profit element where you might have some, where your budgets aren't as tight as my health system, it's a different story. But most health systems are running margins, that are relatively tight. Many lose money. And so you may want to have a better patient experience, but the penalties I personally don't think are severe enough yet, whether it's a Medicare penalty, and also the budgets of healthcare systems are the procurement and the way that budgets are done, they're in silos. So, if I think something be really valuable to my patients or to the people that benefit from a better patient experience score, who's paying for it? It's usually what I built is really an IT cost. It goes to the OCIO silo. It goes to some sort of IT spend. Whether are these the same people who are spending money on security and the EMR? They're not in the patient experience business. Whereas the patient experience group is relatively under budgeted. They're hiring people to make better food, have better parking, get feedback from patients, and so when you're designing ideas that might be fruitful, like I think our idea is very fruitful. It's basically allows providers to use their mobile devices as supercomputers to communicate directly through mobile app to their patients, either through video, audio, text. We can actually upload videos of their packs, all their imaging, their discharge instructions, their medications. These are tangibly beneficial to the patient, but ultimately it comes down to who's going to pay for them. That's been a big challenge.
I want to take a little bit of a retrospective, folks, and just get everyone thinking about where we've been so we could really think about where we're going. Tom, I'm going to come back to you. How have you seen the patient experience evolving over the last 10 years?
Pretty radically. You teed me up that I've been in this business a little over 20 years, and I will say, times used to be a lot simpler, right? There was the provider, there was the health plan, and you had your pharmacy, and it was pretty simple in terms of benefit designs, in terms of solutions that were offered. And over the last 10 years, there's been, in my view, a mix of incredible technological advancements, a shift to digital, and ultimately that has really led to a preponderance of new players in the space. So I'll just take those one at a time. So technology, it's pretty incredible what is out there right now in terms of healthcare. Advances that are being made on previously thought incurable diseases, advances from a technology perspective on how to manage chronic conditions. The idea of being able to talk to a newly diagnosed diabetic, which used to be a massive diagnosis, and obviously still is, but to now be able to talk to them about the incredible technology that's available to them just over the last few years, things like continuous glucose monitors and insulin pumps and closed loop systems, all that tie to your phone or to the phone of your caregiver, remote patient monitoring. I mean, just some amazing stuff that's happening right now. The fact that everyone's walking around with these mini computers in their pocket is incredible, and it again provides access to so much more information, to the point where there's a bit of information overload, right? You can go to the App Store and look at healthcare and just be completely lost as to what is out there and which ones are good, which ones are connected to you, can connect to your ecosystem. And then I think that's finally led to so many players, right? Emerging players solving every niche of healthcare and wanting to really bring these advancements to the consumer, which is great. But I will say, in my observations, that's also led to a little bit of overload, right? Healthcare was already difficult to navigate, and now members are sometimes just lost. They have so many solutions available to them from their health plan, from their employer, available to them from themselves, from their app stores, that they rarely talk to each other, and that's an easy trap that I think we can fall into. And so now I think it's a question for health plans, for providers, health systems to figure out, how do we tie this all together for the consumer? How do we make this so we can leverage all of this great technology and advancements and really bring them along in their journey in a way that ultimately meets their needs?
Great. I'm going to bring in Melinda into the conversation. I want to now talk about moving forward and how Melinda is bringing a true consumer voice into an organization strategy. Like, why is it so important now?
Yeah, thanks, Eric.
Still dealing with technology that's not.
Hey, David, just give us one moment. Go ahead, Melinda.
So thanks, Eric. And so glad to be with everyone on the panel this afternoon. I'd like to actually do a couple of things. One is just set a little bit of framework and context for us to think about consumer experience and consumer engagement in the context of healthcare. And so when we think about consumer engagement, we think about it, or there are really sort of three levels that we can think about it. One is at the individual consumer or patient level, and David has a number of examples in the app that he is or the communication software that he's developed to be able to engage much better with his patients. Tom had a number of examples around how the health plan can actually play a really pivotal role in helping folks engage much more effectively in their own health and healthcare. And that's one kind of engagement. And that's really, really important. And there's, as Tom said, there's a lot of really great work going on. At the other end, there is what we think about as engagement at a policy level. And there are lots of advocacy organizations out there and groups out there bringing consumers into policy decision-making, sort of at a state and federal level, and really trying to have consumers have a voice in the way we set policy, macro policy and micro policy. And then the third level, which is kind of in the middle, is this organizational level. And that's the place where we think about how does an organization actually think about consumer engagement and partnership. And to your point, Eric, about sort of why is this so important from a strategic perspective? And so that's a place where both at CCA and at CACP, we're really focused on helping organizations really moving up, sort of moving the game up from, okay, this is what we're doing to support individual consumers in really engaging and having the best possible experiences they can have, to lifting that to how do we apply that to an organization? What does a consumer-centered organization look like? I would say that our healthcare systems and the people that we serve are facing some of the toughest challenges that we have seen in generations. Like this last year, I think we'd all agree, has been quite a doozy, to put it mildly. And our success in whatever sector of the system we are in is really going to depend on how quickly we can adapt. How quickly can we adapt to this ever-changing environment? And I would posit that the answer, in part, is that the very consumers that we are serving are really the experts that we need to give us the sight lines to be able to do more with less, because that is always, and David talked about sort of who's paying for this, what are the costs, and that's always going to be the case, is how do we do more with less? If we fail to adopt a strategy, a real organizational level strategy, and a culture, an organizational culture that really values consumers as experts by experience. I like to think there are two kinds of expertise we need to solve our problems in healthcare. One of them are what I think about as experts in training, experts by training. That's all of us. We actually went to school. We have jobs in the healthcare sector. We are professionals. But it's really our partnership side by side with those consumers who are experts by experience that we really need. And if we don't adopt that kind of a strategy as an organization, we are going to miss the very key ingredient that we need to successfully design and implement care and services that actually meet the needs of those we're intending to serve, and get us those health and well-being outcomes that we all want to see. And to the point David made and others have made, to actually help us really manage costs. We see the gap really particularly acutely in the space that I sit in terms of, my organization at CCA is both, as David Webster was talking about, we are both health plan and deliverer of care and service. So we are that integrated model as well. Our focus is on individuals with the most complex health and social needs. And so the reason we see these gaps so acutely is we've got folks who have really complex needs. They are the most vulnerable. They have been the most marginalized. We have listened to them less than we've listened to anybody else, and we haven't done a good job listening really to anybody. And they cost, because of their care needs, they cost the most. And so we have really a tremendous amount to gain by making sure that those voices are really integrated across the organization at a strategic level. I always say, and Eric's heard me say this before, if healthcare was any other industry, we would have been out of business before we got out of the gate, because we are the only industry where the desires and the needs of the end user are the sideshow instead of the main event. Every other industry, it's a direct relationship between that consumer and the company or the industry creating the product or service that they need. But as Tom was alluding to, healthcare is not like any other industry. In healthcare, we have all of these potential different intermediaries, whether it's the employer group, as Tom was saying, or in my case, as a sort of a more of a public entity, the regulators. There are a lot of stakeholders at the table, and so then, how do we make the case for a business model that relies on this partnership based model between the consumer and the healthcare organization? How do we make the case that that should be core to our business model? both from a strategic and an operational perspective. And, Tom actually already really, hit the nail on the head here in terms of thinking about the sweet spot being really the center of what is a Venn diagram. I like to say that there's a Venn diagram that has your consumer and your health plan and your delivery system and your regulators and your employers. And there is a sweet spot in the middle of that Venn diagram where you're actually aligning across needs of all of those stakeholders. And that's the place to start. Because in order to get folks on board about this value proposition, we have to start someplace where everybody sees some net gain, given the things that they are most interested in. And then we can proceed from there to really be integrating that consumer voice and that consumer partnership. That consumer voice and that consumer partnership. Feedback.
Yeah, I'm getting some feedback too. Could you guys hear me okay right now? Okay, great. I'm going to get into now execution and how do you truly execute a voice of the consumer approach? Maybe get some examples from folks. David Langer, I thought maybe if we could hear you okay, I'd bring you in to talk about, you had mentioned in your first answer, alluded to the videos that you were doing for your patients. I'm assuming that was a voice of the consumer approach, and maybe you could provide some details on that example of how that works.
Well, I mean, I think you have to think creatively. We go to Melinda's point. I agree. We would be dead in the water if healthcare is a disaster when it comes to space. We have the people who are caring aren't getting paid by the people they're serving. The people who are getting served aren't seeing the money, and so the choices that are made are that this isn't just in what we're dealing with, but everything. I think what I have been really trying to push is the idea of using mobility as a creation as well as consumption. The healthcare system has done relatively well with portals and with mobile access to telehealth or, their mobile aspects to getting structured medical record. But my idea from the beginning was to create unstructured content from the provider, doctor, nurse, physician extender at the point of care, and using these supercomputers to create valuable content in real time. So that's what playback is. It's just basically the idea that if you're carrying the supercomputer in your pocket, if you want to tell the patient what their discharge instructions are, wash your wound or take a picture of it, or this is how to breastfeed your baby, instead of giving you a pile of paper or having the patients go up, look it up on YouTube, they get a video, audio, or a photograph of them with their problem that's memorializing that moment. It has a half-life for sure, but that's all people need when they leave from our environment to home or to rehab. I'm a neurosurgeon, so we often see very disruptive changes when people leave our care and move to a new place. And it's just a terribly difficult problem to solve when you're using paper or patients' memories. And that's why memorializing moments in mobile makes perfect sense. It's the way our kids communicate, it's the way the world communicates, and we're just not using it in healthcare. And I think that's a big mistake.
Love it. Love it. That's a great example. I want to encourage folks. I see some questions already coming in. I have a screen over here. I'm not looking away from everyone where I could see them coming in. I haven't gotten a chance to read through them all, but I will start reading through them and integrating them into the conversation. Another reminder and invitation for everyone to click on that Q&A module and throw in your questions there. Let's take a health plan perspective on that. Tom, how do you execute a voice of the consumer approach? And if you could provide us an example, whether it be at the Blues or a former role.
Sure. So, I think about how you do this, and it really ultimately comes down to structured listening, right? You have to have a very tactical approach of how are you going to understand the needs of that consumer. We have myriads of data of how our members interact with us as health plans, when they interact. And not surprisingly, they all come around very pivotal moments, right? Whether it's the activation, the member has received their health care for their first time, there's an interaction there. When the member is in need of care and they're trying to understand what are their benefits, where should I go? And then after care, what happened, right? So I'm confused I need an explanation of how this worked. And you know, what we've learned, I think, as health plans is that you can always answer the question, right? Answering the question is the easy part because the member's coming to you for a need and you can meet that need. I think the real opportunity, though, is how can we insert ourselves in those incidents to not only meet the need of the member. You want them walking away happy. You want them walking away with their question answered. But how do you take advantage of the opportunity and solve a need for them that they didn't even know they had? That you can leave them walking away saying, that is so much more valuable than I even expected it would be. So you asked for an example. You know, inevitably, when a member calls up and says, or interacts with us in chat or whatever it might be, and says, I need a new ID card, or what are my benefits for fill in the blank procedure? There's a really good chance that they're about to go get a procedure, right? And so you can answer the question as minimally as you want, and you can say, here are the benefits, and you quote them and send them on their way. Or you can do that and then say, it sounds like you're about to go and get that procedure. Did you know I can help? Did you know that I can help you understand who's in network? Did I help you know that different providers charge different rates? And I can help you maximize the benefits that you have available to you. And I can make the appointment for you. And you just start adding on all of these opportunities. And when you walk away, and it gets back to what Melinda referenced as that sweet spot in the Venn diagram, now you have solved the member's immediate need. You've added far more value to the member than they thought they could have gotten out of the health plan. And you've also solved some of your other needs as well of how am I optimizing site of care? How am I eliminating waste? How am I controlling the spend of healthcare? And that's what's really exciting about how you can take advantage of some of those opportunities. But it all starts with listening and understanding when those opportunities are, what permissions you have, and then finding ways to expand on.
Melinda, how does that differ from approach at CCA, and how are you guys in general executing the voice of the consumer approach?
Got to get myself off mute. So I think there are a number of similarities. I mean, I think the concept of discovery is really, really important and is foundational to organizational success. I really think at the end of the day, there are four components of what I think about as a truly consumer partnership-based organizational business model. And the first is, as Tom really talked about, discovery. Really understanding the current consumer experience, journey mapping, understanding that all of the touch points that the consumer has with you as an organization and what's working and what doesn't, because that's the only thing that the consumer knows is the actual experience that they're having with you, those touch points that they're having with you. Everything that happens behind the scenes to make that touch point happen, totally irrelevant to your consumer. That's an organization problem, not a consumer problem. So that discovery piece and really understanding the consumers that you are intending to serve is just foundational. But then I would say the second component is what I really think about as design. And that's about how do we engage consumers in improvements and innovations early so that we drive a focus on initiatives that will best meet consumer needs. How many times have we as organizations embarked down a path, done a great job at discovery and really listening and understanding what our consumers want and need. And then we stopped and we then internally said, okay, we got all these great solutions. Let's do X, Y, or Z. And we start down the path to do that. We get almost down the path and we say, oh gosh, we forgot we should actually really be still listening to our consumers and bringing them in as partners. Only then it's too late because we've actually invested a whole lot of resources and energy and dollars. So we're just going with it. And then 9 times out of 10, it doesn't work. And so when you think about this from a resource perspective, how often are we wasting resources because we think we know what the right solutions are and we think we can do it on our own? work that we do in the center where we do journey mapping with folks. And I see this to an organization. When we look at what an organization thinks is important to their consumers or their patients, and we juxtapose that with what we actually hear from the consumer or the patient or the member, there is a discrepancy of a discontinuity of about 50%. The organization is getting it wrong almost half the time, or at least half the time. So think about the resources that we're wasting when we get it wrong. And it happens to all of us all the time. So the second is really about design. Then the third is about implementation. So even if we discover, we bring consumers in terms of what we're designing, the way we actually implement and execute is really important. And if we aren't bringing consumers, again, in as our partners side by side with us, then we'll probably miss important cues about how best to communicate and how best to implement those changes, whatever those changes are. And then finally, it's evaluation. We as organizations tend to really focus on evaluating the things that matter to us as organizations and to some of our other stakeholders. We tend to value less evaluating based on what the consumer truly finds is important. So engaging consumers in how we measure success and how we identify opportunities for further improvement is that fourth component. And you can kind of see that's a circle, it's a cycle, and you do it over and over again in terms of truly executing on an authentic sort of partnership-based model.
Thank you for that. Melinda, you have that e-summary on journey mapping. Are you okay if we just sent that out to folks who wanted just a quick review of it?
Sure, that's a great idea. Absolutely.
So it's like a 4-pager, folks. So it's real easy read. Sherry, why don't, if you have time, set up a poll. The e-summary is on just how you could up the ante with journey mapping and adopt an approach that is truly at the forefront of the industry. So I would challenge you guys to think, I'm doing journey mapping, how could I raise the bar with it? And this document could potentially stimulate that thinking. So we'll put up a poll, and if you press yes on it, we will get you a PDF, so you don't have to register for anything. Just click the yes. We'll send you an email out, and you'll get a copy of that. For those actually listening to the podcast, you're not going to have access to that poll. Why don't you do this? Why don't you go to sharedpurposeconnect.com/CCA. So really easy to remember, sharedpurposeconnect.com/CCA. And I'll put up a form. If you fill out the form, I'll get alerted and I'll personally send you that PDF via email. So that's how we'll do it for those listening on the podcast. This could be a good time just for me to, bear with me, folks, just to give a quick shout out again to CACP, our sponsor, the Center to Advance Consumer Partnerships. They help organizations realize untapped value of the consumer's voice. So I want you to get some history on why they're so good at this. CACP builds on a proven approach pioneered by its founder, Commonwealth Care Alliance. Commonwealth Care Alliance is a non-for-profit, community-based healthcare organization in Massachusetts dedicated to improving care for individuals who are dual eligible for Medicaid and Medicare with complex medical, behavioral health, and social needs. So they work with innovative healthcare and human services leaders at organizations across the country to develop capabilities. They also build infrastructure and cultivate relationships that ensure that your consumers with the most significant needs become enduring organizational partners, which is invaluable, of course, as Melinda just pointed out, to shaping strategy and action. So together as partners, organizations and consumers are now inspired to build trust and co-design these solutions that really work to improve outcomes and enhance the overall experience. And we're going to get into a little bit later why that sort of translates to good business. You could check out more around what CACP does at www.consumerpartnership.org. And if you wanted an introduction to Melinda, who you could already tell is a wealth of information. She's been on our show numerous times and she's terrific. If you want a personal introduction, just email me at eglazer@sharedpurposeconnect.com and I'll make a personal intro for you. Okay, I'm going to jump back into the questions, folks. David Langer, I'm going to come back to you. The Voice of the Consumer initiative. it could be whatever it is. Those initiatives are very tactical. They start, they end. How do we incorporate the voice of the consumer into an organization's culture, the fabric of who they are, from the very bottom of the organization to the very top? How would you suggest doing that at your hospital?
I think it's a matter of incentive. I don't think that I saw one of the questions about pharmacy delivery. One of the observations we've made is that unless we can somehow connect kind of the ultimate financial incentives that are necessary to drive any change. For example, we wouldn't have EMR if there weren't meaningful use, and meaningful use criteria were created by the government to basically prove that you're using the medical record so that they would pay for it because they wanted to convert everybody to digital. Well, if there weren't financial incentives for hospitals to put this stuff in, it never would have happened. And the government knew that. And so I think the longer I've gone through this business and been in this space, I know we're doing great stuff. Our organization is very customer centric. At least they talk that way. They want to be innovative. They want to, we have all sorts of marketing campaigns and, advice to our doctors, nurses, and other caregivers about to be responsive to this. But I think I'm a little bit nihilistic about it. But I do think that unless you have real financial incentive and a real financial benefit, it's going to be hard to convert culture. You can say all you want, you can do all you want, but unless there's a real financial incentive, you can't hire the FTEs to really make this happen. You can't provide the support. You can't get people to convert over. And our feeling is that it lies in drug delivery, that the amount of money lost by healthcare systems, especially large ones that have pharmacies, is huge. And if we can link the patient experience and the cost of deploying something that's really tangibly different for the healthcare provider, and provide the training and the support and the failover and all the necessary tools that are necessary to develop those things, the hospital has to at least break even. And hospitals are losing money all the time when patients leave the hospitals without buying drugs from that hospital, especially with the ones that have pharmacies. That's what Amazon's all about now. They're trying to create ways of consumers buying their drugs. Well, we have them at hello. When they're about to say goodbye to us, let's have them buy the medications. And so what we're really totally dialed in on now is we're going to create a way on mobile for customers to buy their medications through a patient experience app. And then that'll pay for the support for the app. And I think it's just connecting some silos that never existed before, going back to the original point of who's benefiting, who's paying for it, and where's the money coming from. And I think, unfortunately, patient experience has a low, the measurable value during the budgetary process of what's really being made is hard to measure. It crosses too many silos. Whereas this seems very tangible to me and ought to be the focus in order to get the patient experience improved.
Great. How about David Webster? Haven't heard from you in a little bit. Tell me a little bit about how you guys at Highmark are thinking about incorporating it into your culture. How do you do that?
Sure. So I think like many things at an organization, you need to focus on it, measure it, and incent people to deliver. So as an example, if looking at customer service calls, so I'd say intersection for many members with a health plan, and if quality is the only thing we reward during that customer interaction, we can't expect calls to be delivered with empathy. All we can expect is accuracy, because this is the behavior we drive. But if we're measuring how someone feels at the end of that interaction, and that becomes the most important metric, and people are held accountable for it, we get the outcome that we are striving to achieve. We also have to provide employees with tools that they need to empathize. In the health insurance world, often think about people by market segment. So there's Medicare line of business, the Affordable Care Act line of business, commercial line of business, et cetera, but not by their unique personal situation. We've developed customer journey maps and personas to help their organization place a name, a face, and our journey and real world scenarios on the work that we're doing. When we started to use these personas and journey maps at the center of what we do, we started to see a huge improvement in our work because people began really thinking, instead of a Medicare member or a commercial member, thinking about Carol or Eugene, not just a nameless faceless group of members. Some of the things we've done tactically because of that incredibly helpful input we've received from customers include a couple of items that come to mind. Everything from the benefit structures. The benefit structures for health insurance is not particularly easy to understand, so we've introduced multiple ways to access the service to help better understand those details. We've worked even more with employer group clients so that they have the information they need to educate their employees. As a physician leader at the organization, think a lot about care models, treatment pathways for chronic diseases. But it's imperative, in addition to thinking just about evidence-based medicine and making sure that's being followed, it's just as important, or maybe even more important, that we both have treating clinicians as well as patient input to facilitate engagement in those programs, so that come up with these programs to drive clinical outcomes, but they only are as good as we get people to be part of those programs.
Great. And Melinda, from your perspective, you you did it at CCA and you do it at hospitals all over the country. How do you take a bunch of great siloed tactical initiatives and make it an overall culture?
Yeah, it's a really great question, Eric. And, and I go back to David Langer's point about, the silos that we all live in, and the larger the institution, the more silos there are. And I'm going to answer your question in 1 second, Eric. I just do want to go back to the ROI question, because it's, because you're right, David. It is sort of the underlying current underneath consumer engagement and consumer experience, and the feeling over the last 30 years that this is really soft, and how important is this really? And I think more and more we're starting to see organizations through their own measurement programs and creating holistic measurement programs, really starting to create that ROI. And that is a fundamental foundational element that organizations need to think about when you go down this journey of authentic partnership to get to experience and better outcomes, is really thinking about how are you going to measure your success so that you can demonstrate that ROI. On the other hand, I would say as organizations, our financial leaders need to be thinking about ROI a little bit more broadly than some of the silos that they think about ROI in. And Eric, we could have a whole other panel about just this conversation. But I just wanted to acknowledge it, that it is always the elephant in the room when we talk about patient experience, when we talk about consumer engagement, and it is really important. We are starting to see it shift. We are working every day in my organizations to create those models to demonstrate ROI, because that's what it's really going to take to really transform our systems of care and service in the United States. But now, to go back to your original question, Eric, in terms of how we take something like Voice of the Consumer that is so tactical often and feels sort of ad hoc, and that people do it in a project here, a project there, and how do we make that really part of embedded in the fabric of the culture of an organization? And I think really the first way to do this, one is about journey mapping, and several colleagues on the call have talked about journey mapping. Journey mapping is probably the single most effective way to break down silos and to pull folks in an organization together to start to see how the work that they do in their silo impacts the journey that consumers have upstream and downstream. And so I think that's an important piece. But even before that, I think there's the concept of readiness. What is the level of organizational readiness to engage in building a partnership-based or consumer-centered model for their organization? And there are really kind of four pieces to a readiness assessment. One is really thinking about your external environment. And, David Langer talked about the incentives. What's going on in the external environment that actually is going to potentially facilitate your pathway because your regulators are saying this should be more important, or the payer is saying you need to have this, consumer engagement as part of how you do your work, or not. But what's going on in the external environment? And then to think about organizational intent. What is, as an organization, do you have an intended experience that you want to be delivering to your consumers, that your consumers have told you this is really important? And is there intention and proactivity in terms of how you think about consumer experience and consumer partnership? And then the third piece of the readiness assessment, sort of the third major domain, is about ability to execute. Where are you as an organization in terms of your own capabilities and capacity to be able to take on this work, to be able to listen to your consumers in an ongoing, proactive way, synthesize all of that, integrate it into the way you make decisions as an organization. And then the final domain is really around, your ability to learn as an organization. What do you do with the insights that you get, and how do you actually create change with those insights? And again, it comes back to sort of capabilities and capacity around how you seek insight and how you manage those insights. And then once you've done that readiness assessment, you can see where you are. Then you can start to see where you've got real strengths that you should be leveraging, where you've got gaps that you need to be working on, and create the right roadmap for your organization to move down a pathway. I mean, really, there's an arc to consumer engagement and consumer participation and partnership, where organizations often start at what I think about as feedback. Everybody does surveys. We often, if you're a health plan or a hospital, you have to do CAPs. Everybody does surveys. Most organizations do way more surveying than just CAPs so that they can really try to influence those CAP scores. They may do other sort of point of service surveys, and that's important. And that's what we think about as feedback. That's one-way communication. You're asking questions, you're getting some answers, and hopefully you're doing something with that. But then sort of the next stage in the journey of maturity is moving really from just getting feedback. It's not an and or, but it's not an or, it's an and. Moving from getting feedback to saying, okay, how do we actually do a better job consulting with our consumers about whatever it is that we can have a focus group, we can interview them. Physicians and clinicians consult with their patients every day, hopefully, in trying to figure out the right solutions for them. And then moving from that sort of consultative to collaborative or co-design as you get to be a more mature organization. And then finally, the sort of penultimate place to be as an organization, this is going to scare everybody on the phone because it's a scary concept, is getting into co-governing or co-sharing decision-making. And so what that really is underneath that is sharing of power. And that's a very scary concept. And I'm not sure there's an organization in the country that, and if one of you are on and you feel like you do that, I would love to hear about how you do it, because it's very aspirational for most organizations. I think we think about the federally qualified health centers, for example, as, 30 years ago when federally qualified health centers were mandated, part of their mandate was that 51% of their governance needed to be those individuals and the community being served by that community health center. And in practice, what we found is that that's a great concept, but translating that into practice, into really governing, is challenging, because those community members without training and support don't have the skill set to actually participate in governing. And that's the missing link. And so we haven't seen community health centers be able to be as effective as I think they would have liked to, or we would have liked to have them be, because we couldn't really, we couldn't execute very well. there's one example, and it's not really an organization, but one example of that sort of really sharing of power is the Ryan White HIV/AIDS program. We could spend a whole session talking about this. We don't have time to really go into it. But the bottom line is that the Ryan White program, the budget for it in fiscal year 20 was $2.5 billion. So lots and lots of money there. And that program actually it's a federal program, requires that a third of the people on these sort of regional governing boards that decide how the money is spent regionally are actually Ryan White clients, are actually the people in the community receiving the services. And it really works. Check it out. There's lots, if you just Google Ryan White HIV/AIDS program, you'll see lots of examples of how that's one example in the United States where we have actually been able to effectively share power with those. The folks closest to the problem generally know the best solutions. And this is one place where we've really been successful. So a few examples.
Perfect. Tom, before I transition over to you, I want to just make a quick note to my production team. This will mark the end of part one. So just my production team knows this is where we'll cut it. A little bit behind the scenes here, folks, of podcast production. So if everyone can indulge me for about 20 seconds, I'm just going to close out the first portion of today's webinar. You don't have to leave. I'm going to get right into it. I'm going to give Tom the ball in a moment because he's got some interesting things to say about this. But I'm just going to do this. 3, 2, and 1. Thank you to our terrific group of roundtable experts. Make sure you download and listen to part 2 of this special episode, where we're going to get more into building a consumer-centric culture. We'll also get into the ROI and impact further, which is something we sort of brushed upon in episode 1. So look into the future on how the voice of the consumer, we'll also look into the future of how the voice of the consumer and the member journey will evolve. So thank you all for listening, and we look forward to you joining us for episode 2. All right, perfect. Thanks, guys. Now, Tom, let's start with you. I'm going to ask you a two-part question. I want you to kind of build upon a little bit about kind of converting to a voice of the consumer culture. You've heard a lot now from your 3 fellow panelists. And then maybe if you could kind of continue on and building into sort of our next question, which would be, how do you advise everyone listening today on how to start a consumer-centric, empathetic program at their organization? So I'll let you kind of finish off the last question and lead into this next one.
Sure. So, a lot of great information's already been shared on how do you change culture. But, in my mind, it comes down to making it a priority, right? There are lots of things that any organization is trying to achieve, and it is very easy to be tactical and to go where the fire is burning the hottest without necessarily maybe addressing the underlying problem when it comes to the voice of the customer. So it's making it important and making it a priority. And I guess that leads into, well, how do you do this? How do you make it important? And I guess there's 3 thoughts I have. The first is you likely need to have some kind of a dedicated individual, or ideally a dedicated organization within the company that's going to focus on customer experience. Too often I've seen CX fail when it is a nice to have, when it is done off of the side of someone's desk who also has a tactical job that they need to be doing. And so if you can have, it doesn't need to be a massive army, but if you can have a small but mighty group of folks whose job it is to really listen, to measure, to monitor, to evangelize throughout the entire company the importance of the voice of the customer, that becomes very powerful. It says a lot about your company. It says a lot about the importance of this aspect to your strategy. And it allows people who are really good at this, that this is their job. This is their job to listen, and this is their job to adjust and to pivot and to find ways to deliver a far more exceptional experience to the customer than they ever thought they could have gotten. So that's the first thing. I think the second thing is making sure that it's not limited to that group, right? So it might sound contradictory. I said, well, listen, you just got to set up a small group. But again, it's a small group who then takes that message to every other part of the organization, who has to also then make CX their own. They have to be thinking about, how do I, as an IT shop, improve the voice of the customer and the customer experience? How do I, as an operation shop, do that? How do I, as a sales organization, do that? How do I, as a product development area, do that, right? Everyone needs to be thinking about the voice of the customer and not fall into the trap of, well, no, that's them. That's that CX group over there. They handle everything, right? CX has to be a huge part of everyone's strategy, and the small customer experience team can help facilitate and shepherd, but it needs to be brought and owned by everyone. And I think how you make that possible is my third point, and that this has to come from the top down. There has to be top-down support of customer experience, and that top-down support has to be very directly communicated to not only all staff but to leadership, that this matters, that this is how we're going to measure success, is how we infuse the voice of the customer into our solutions. Because when that top-down leadership says it's important, it all of a sudden becomes very important to everyone. And when people start getting measured on how we're doing when it comes to addressing the voice of the customer, progress starts to get made. So those are just a few thoughts in terms of if you're setting up the shop, or if you're looking to maybe improve the customer experience role within your organization, some things I've seen work.
It's great, Tom. And before we move over to like bottom line, and I'm going to bring the two Davids for that. Melinda, what about a quick blueprint? You do this so often. Is there a blueprint for folks listening on what they need to be thinking about right away to get this moving?
Yeah, I mean, I actually think Tom has done a fabulous job teeing this up in terms of, what you really need to be paying attention to. And, we work with organizations all over the country, and I can tell you pretty much to a one, if senior leadership isn't engaged, it doesn't work. And so you got to have your C-suite at the table thinking it's really important, as Tom said. And then, I can't stress enough Tom's point about the consumer voice and consumer partnerships, seeing your consumers as experts that you need to have around every table, needs to become part of the fabric of the way the organization does business. You can build the most amazing sort of consumer partnership or consumer experience shop, and it's not going to get traction because, as Tom said, it seems like this isn't my job, it's somebody else's job. And it's that notion of accountability versus responsibility. Certainly having dedicated people to focus on consumer partnership is really, really important, and they become the accountable team for the organization, but that doesn't absolve the rest of the organization of daily responsibility. And the way organizations, I think, can really get traction in thinking about this, through a cultural lens, is really looking at the tools and the approaches that you use to develop strategy. When you have a business planning or a strategic development tool, does it actually explicitly require you to do some member impact or consumer impact analysis? Does it actually require you to talk about how you're going to engage the consumer in the development and design and implementation of whatever the solution is that you're doing? Those are very concrete, tactical ways to start to build in to the way you do your work, these really important questions, so that, I always like to say, you never go to your executive team with a proposal to do something that didn't have a budget, because you get laughed out of the room. Like, that'd be the first question people would say is, well, how much is this going to cost? Well, as an organization, how can you help leaders and staff across the organization get to a place where, when they're doing design work and development work, you're adding that consumer piece, that you'd never go to the C-suite with a proposal that didn't talk about, and here's how we're going to be making sure that we have voice of the consumer in what we do. And then there is infrastructure development that goes along with it. But I would argue that in most organizations, you don't need much of a shop that's in addition to what you already have. It's about doing it differently. It's about having people thinking about the work differently and applying their skills and their approach differently, rather than, gosh, I got to build this whole big team to be able to do this work.
So David Webster, how does the consumer experience now impact the bottom lines of the various businesses? And David Langer, I'll come to you next.
It's very important looking at the business outcomes, the return on investment. As David said earlier, that's important in any organization. And at Highmark, we measure the Net Promoter Score. And it can be challenging to tie financial value to that number. We've tried to map it to line of business, making assumptions such that a 1-point gain in NPS will bring some level of additional revenue. But I think it's important to note that Net Promoter Score isn't driven by one thing. It's driven almost always by a variety of consistent efforts over time, and it's hard to tie to specific projects. We have developed assumptions regarding ROI for specific projects that we believe can positively impact the customer experience. So that's where we tend to focus on value, but include some broad assumptions that improvements in this NPS will ultimately drive brand Net Promoter Score and continue to look to increase that number. But a couple of things that are important to see how that we strongly believe how it helps improve the business or is good for the business. One is looking at commercial renewals. So for commercial insurance, we sell to employers. Employers buy our services, and then we insure members. So by increasing that customer satisfaction, by incorporating the voice of the consumer, we strongly believe that helps with renewal and with clients. For the Medicare Advantage members, for Affordable Care Act members, they choose who they want to have insure them. And we believe that by having incorporating that voice of consumer to increase our Net Promoter Scores, that helps with both renewals or customers deciding to stay with Highmark either on the plan side or on the care delivery side, and in addition attracts new members. I'll use as an example, this year, J.D. Powers named us as the #1 in the nation for member satisfaction for Medicare Advantage plans. And I would tell you, as being part of that work as a physician, it is a lot of people having a never-ending focus to help drive that, drive those outcomes. And then furthermore, as my audio there. Furthermore, as a clinician, as I spoke earlier, when we deliver, we have and develop treatment pathways, care models with physicians, it is imperative to engage with patients, with customers, so that we can understand what they want, how they want to access said services, so that we can help deliver superior clinical outcomes, which is results in better outcomes for our members and is helpful to the business.
Good stuff. Before David Langer comes in to talk about his perspective on the bottom line.
Can I just push back on?
Oh, go ahead. Go ahead, Dave. You're up, Dave. Can't hear you, David. I'm going to stall for you.
You hear me now?
Yeah,
hear me
that's
now?
better. Go ahead.
If you have cancer and your surgeon's a total jackass and you get bad food and the parking sucks and you have a semi-private room, but you're cured, you're going to go to that guy. And if the guy is great food and the parking is great and the environment's great and you die, the outcome's better with the better cancer doctor, even though the patient experience sucks. And the bottom line is that's what we're up against. Because physicians, I'm a doctor every day. I hear what you guys are talking about. And a lot of this makes an awful lot of sense, but doctors aren't incentivized to really care that much about this. When I show doctors my thing, they're like, I don't have time for that. And we have all these people that, I started out in 98, I left residency. We didn't have people like you in the hospitals. No one cared. And that's the truth. Now, the organization made a real effort to change this culture, but we're not incentivized properly. We don't have the right tools in our hands to make any difference. No one's really helping us do this. We get Press-Ganey scores and HCAP scores, people criticizing us and telling us do this, do that. Our phones don't get answered. The nurses might be in a union. They may not have as much incentive. The nurses aren't getting incentivized properly. Come on. And so ultimately the whole key is finding something that makes the hospital money. I hate to admit this because I'm just the opposite of this. I'm salaried. I don't like 10 operations or 10,000. I get paid exactly the same, but I'm incredibly frustrated by the environment working, and I want to do the right thing. I've been working on this for years, but unless you connect these ideas and tools to hard cash and find out where in your organization somehow people really benefit financially, and that's translated back to the delivery vehicle, you're going to struggle. You just will. Now, what I agree with Tom is it's got to come from the top down. The CEO level and all the leaders have to identify this and make this a real North Star and a real shiny object. But by the same token, give us some tools. You got to put your money where your mouth is. And hiring more people doesn't necessarily do it. All of a sudden, we have people in our midst from the hotel business or the entertainment business running around and telling us how to behave as physicians and nurses. They don't know what it's like to operate. They don't know what it's like to take care of patients. They don't know what we're going through. And then yet they come to us with this kind of like attitude, like we can do this, we can do that. We have meetings and huddles and everything else. That's why we haven't made a lot of progress in a lot of space in large bureaucracies. I think there are aspects of this in certain very kind of maybe more directed hospitals and maybe some boutique kind of bespoke places that do this very well. But at the university level, at the real high level, large healthcare systems, they all struggle with this. And that's why I really believe that the patient experience world has to identify a real financial benefit that's linked into something that they do. And when they do that, they'll connect two silos, and the silo that benefits financially will pay for the patient experience piece, period. And then we'll be cooking with gas.
So, Eric, if I could just respond. So, I hear the passion in your voice, David, and I hear the frustration. And, as someone who spent my entire 25 plus year career doing this, I share your frustration. And, I would argue that our hospital systems in particular, and this way, and I'll probably, whoever's on the line, and, I'll probably end up getting hate mail for this, but CMS and CAPS have done us all an incredible disservice, honestly, in creating a focus of, that experience, particularly when we think about hospital systems, that experience is defined by food and parking, and because that's not what this really needs to be about. And, I would say that not only is it about getting executive leadership on board, but it's actually about shifting the paradigm and the lens about what it is that we're even really talking about here. And I would bet, David, given I don't know a lot about you, but given your passion, that you are actually partnering with your patients every single day and working with them to make the best decisions that you and they possibly can, given the context that they live within, to get them the kinds of outcomes and particularly in neurosurgery, to get them what's most important to them and for their lives. And what I'm talking about, and I think what a lot of us here are talking about when we think about sort of partnership and experience, is taking what you do on a daily basis with your patients and lifting that to an organizational level. And that's very different than, my CAP scores and how good the food is and how good. It's about saying, how do we listen at an organizational level so that we're actually designing care and service that gets us the outcomes that we want. You know, it's taking what I know you're probably really good at a one-on-one level with your patients and raising that up. And there is an ROI to be had there. And I agree with you that for many systems, until we explicitly connect those dots, it's going to be an uphill climb. And, you know, we work on that, you know, we work on that every day, figuring out how to connect those dots. But
I'll give you a typical example. The discharge process, completely broken.
Yes.
It's the last chance you get before you're paid. It's disastrous. I mean, the content stinks. The EMR controls it. The people who are discharging the patient don't know what's going on. It's a total mess. It's been because you know why? Because hospitals were always paid to get patients in the hospital, not to get them out. Period.
Yep.
And so we were stuck with this kind of Byzantine, totally balkanized process, whether it's during the hospital stay, through the EMR, or the way we're financially organized. And overcoming that requires rethinking why that's the case. That's what I'm saying. I agree with everyone's sentiments. Don't get me wrong. I do practice this every day, and I'm frustrated as hell. You know, I am. That's what's driven me to change it. But I've come up against like tremendous infrastructure and conservatism and lack of, like, people want to be creative, but when the rubber hits the road, you're dealing with a lot of bureaucracy, and making these changes hurts, and it takes money. So ultimately, you got to find a way to make this financially beneficial on a spreadsheet, not on some aspirational HCAP score or star rating, which it's all kind of washed down in those things. And it's not a one-to-one. And when the budgets are made and the hospital procurement process is done, the capital, budgets are done, it falls through very often. And that's why it's taken so long to correct.
Tom, I'm going to let you, I was going to come to you, but knowing some of your answers here, I'm going to want to know how you want to address it, but I'll let you take a second. It occurs to me, guys, so next week's Thanksgiving, so we're going to, hopefully everyone will have time to kind of take some R&R and relax safely with their family. So we're going to put up right now our next episode. Our next live episode is going to be on relocalizing healthcare, and it's going to be with David Chase. If you're in healthcare, you probably know David Chase. He's a huge name and pioneer in reinventing healthcare, and he's got a new book out, and he's going to come on the show and talk a little bit about his vision on relocalizing it. So we'll put a poll up. If you guys want us just to register you, we will, and that will save your inbox some space from me. And also, I thank you guys in advance. I know this is a unique 90-minute session. We sent you out a feedback form about 15 minutes ago. If you don't mind taking 2 minutes, just give us your feedback. You all know who attend these shows regularly that you guys drive my programming by way of that feedback form. So I thank you in advance for doing that. So Tom, do you want to react to that? I mean, we're coming here to the close of the show, but I know you were prepared to talk a little bit about some of those metrics that were just being talked about unfondly. How do you want to react, or do you?
No, yeah, I'm happy to share, and I'll be brief because I know we're wrapping up. But my sense is there is ROI there. I agree with Melinda, and I think it can be ROI for all of those players that make up the Venn diagram, and finding out those solutions that do provide ROI for everyone is what you need to ultimately solve for. So there's an ROI that's there for the health plan, both in terms of retention, in terms of an informed consumer. There's an ROI for the purchaser in terms of lower healthcare costs and a healthier employee. There's an ROI for the member themselves because they are now engaged in the process far more than they ever have been, rather than just kind of slogging through the journey. And I think there can be an ROI for the provider as well, especially in the right financial mechanisms, because they're providing a better service, which should mean more volume to them and better volume to them. I think it really comes down to, can CX lead to improved outcomes? Because if it can't, then it's all just window dressing. I think that's what's been talked about, but we believe it can. And if you can solve for that, we think that there's ROI there for everyone.
Can I just say one thing? I agree with this ROI. There's 100% ROI on malpractice, on readmissions, on, all your everything's benefit. But who's going to pay for it? There's definitely ROI. Like, I come from Northwell, And it's a huge, the silos of these different things. The trouble is the deliverable requires someone to pay for it, whatever that payment is. And that's why we talk about these things, but crossing silos, the benefit is not necessarily the people who are paying it on their budget. And that's due to the way that hospitals, at least our hospital system, is structured. And it's a challenge. It's not insurmountable, but it's a challenge.
Any other final comments on this question? Because I think we're going to end it here at risk of going long on ROI. Any final remarks? I'll kind of put a jump ball out there. Okay. Awesome. So I want to thank the four of you for taking 90 minutes plus preparing with me ahead of time. That's a lot of time out of your busy schedules to be here. So I really do appreciate it. And to all of you who have taken the time and hung in here for 90 minutes, really appreciate it. For those of you who are listening on the podcast, hopefully you enjoyed this special 2-episode series. I want to give a final shout out to the Center to Advance Consumer Partnership, CACP, Melinda Karp's organization. They are really pioneering how healthcare organizations are addressing this often untapped value of the consumer. And again, you could learn more about them at www.consumerpartnership.org. This will mark the end of this episode of Bright Spots in Healthcare. Everyone have a wonderful Thanksgiving or holiday or break. And we'll see you here in 2 weeks for the episode with David Chase on relocalizing healthcare. Thank you.
Thanks, Eric.